Obamacare, the Democrats have given up on Obamacare. You don't hear anybody defending Obamacare. They're off to the next thing. And the next thing is we're going to give everybody free health care, and you just let the government do it. And when the government controls the budget, then you get people like me get really, really nervous. So you ask me why I'm here. I'm here to protect my little girl and lots of others like her, to make sure that parents, consumers, individuals have the power to make sure their children get the care they want. And that's what we do with this bill. We stop single payer in its tracks. Why? Because we take the money that is now dedicated to Obamacare, which is going for Medicaid expansion and for tax credits, and we eliminate those programs. We tip the money out of Washington, and it goes into the states. Why is that important? Some people say, well, you're not tearing it out by its roots. What we do is we tear out the root that could grow into a single-payer healthcare system, because that money is no longer in Washington. It is now in Governor Bevin's hands, and it's now in Governor Bryant's hands, and it's in Senator Reeves' hands. And I know these guys, and they're conservatives, and they're great guys, but you put money in their hands, it's going to be hard to get money out of their hands, right? If you now have given the states control and the ability to put together a health plan in each state, and those people who crafted that plan have ownership in that, you go ahead and try to federalize that system someday. It won't happen. It won't happen, because both sides of the aisle will be invested in the system in their own state. So we will cut single payer off at the knees. You want to talk about anything, all the things that this bill does, that may be, from the long-term perspective, the biggest benefit of this. So we don't end up with the kind of healthcare system that I'm most afraid of. But the beautiful thing is we don't just do that. That's a big picture thing. We actually help people more. We actually provide better health insurance and better health care. The money, just to be very quickly, what do we do with this money? It goes into three places. First, it goes into a block grant, as I mentioned before. The block grant goes to the states. We do not make a recommendation of how those monies are allocated. We are leaving that to the United States Senate as they put together the bill pursuant to this general proposal. But the idea is to give the money to the states and to make, at least in the initial first 4 years of this plan, that no state is harmed. In other words, no state loses money, gets less money the next year than they had the year before. So no state is cut, and that they have the ability to take this block of money, which was all the Medicaid money and all the tax credit money that was going to their state, and they can have that money to be able to redesign. Now, it's minus two things. It's minus, we repeal the employer mandate. So the money that was collected for the employer mandate is not going to be part of the block grant. Secondly, we put money to expand health savings accounts. You heard the comments from the Hoover Institution about medical savings accounts or health savings accounts. I know Peter Ferraro was here earlier. I introduced the first medical savings accounts, which later became health savings accounts bill, back in 1991. And Peter Ferraro and John Goodman and many others were the folks who actually planted that seed with us and been a very strong advocate. But there is nothing that will do more to reduce the cost of health care than getting the American consumer involved in health care purchases, which they are, by and large, many are, but more need to be. Health savings accounts will expand from roughly 22 million people being in health savings accounts, but under our proposal, according to estimates, it'll expand to 84 million people. 84 million people. Now you're talking about an army of consumers that is large enough to bend the cost curve, lower costs when it comes to healthcare, drive competition, transparency when it comes to providing healthcare services. The reality is that we need something to drive costs down, and the best way to do that is not to cut people's reimbursements or cut whatever. It's to have competition and consumers create more efficient marketplace in healthcare. And the final piece, as I mentioned, is the block grant. And the block grant will be given to the states, again, the expansion states, the states like Governor Bevin's state, will be held harmless for the first 4 years. States like Governor Bryan's states will grow over time. We will have money that will be set for every year. It'll increase every year. That increase will go to the non-expansion states. And over a period of years, we haven't set what those years are. That's a negotiation for another day on Capitol Hill. But, anywhere probably in the area of 7 to 10 years, that probably my guess is where it would land. There will be a coming together, and at some point, everybody will be on a per capita basis getting the same amount no matter what state you live in. There's a huge inequity right now in the way Obamacare is administered. You have 31 states that get the lion's share of the money. And of course, most of those are blue states that the Obama administration was able to encourage to expand Medicaid. And so the reality is this is treating millions and millions of people who are lower income, who are not getting any help from the federal government, a much more decent and fair shake. It's going to be very, very difficult for a lot of senators from, let's say, Missouri, for example, or Alabama, or Indiana, or others that did not do a big Medicaid expansion. Those states are going to do far, far better. Under Maine, I can list, you look at all the non-expansion states will do very well under this proposal, and their states, the poor in their states will get more resources, the government will have more resources. The other thing we do is we end an entitlement. So we get rid of Medicaid expansion, and we do not add a new entitlement. It's a block grant, and the states are free to give the money to whoever the states determine is best to do in a fashion that they believe is best. But they have to spend half the money, at least, in the private sector. They have to spend half the money, it can be a different half, overlapping half. Go back to your algebra, Venn diagram, overlapping 50%. 50% has to be spent on people at or below 300% of poverty. So it has to be spent on low income. And a percentage has to be spent, this is very important because Governor Bryant mentioned this about pre-existing condition. We are not recommending that the Senate and the House remove, as President Trump has been very clear about, the protections for people with pre-existing condition. That's vitally important. We're going to do that. We're going to give the opportunity, though, for the states, in fact, require them to actually pay. We're going to pay the states to pay for the care for those who are really sick. So when people say, they're going to throw the people out with pre-existing condition and the people who are really hurting in this country, they're not going to get covered. Wrong. Let's just be very clear. Wrong. We are not changing the pre-existing condition clause, and unlike Obamacare, we're actually giving money to the states to make sure those who are sick get coverage. So the left can go and scream and holler about all these things. It's just not true. This is a bill that gives states the flexibility, but the requirement that they cover people with pre-existing condition, and we don't just make them do it, but we give them the money so they can do it. I know governors don't like to have requirements, but if they do have requirements, they like to have the money to pay for the mandate. We do it. And so understand that this is a proposal that gives flexibility, that gives choices. We call it the Healthcare Choices Act. Why? Because every person in the state of Mississippi and Kentucky and every other, Virginia and every other state who is low income will have a choice under this plan. You either have a choice by having private insurance with some assistance from the state to buy it if you're lower income, or if the state decides to take a portion of their money and set up a government program, which I'm sure maybe some of these more liberal states may want to do. States can do that. But if they do, the individual that gets assigned to that program has the choice of getting out of that program, taking the cash equivalent value of the government dollars for that program, and going to the private sector and buying their own health care. Everybody has a choice of a private plan. No one gets locked in. No one gets trapped. That's why we call it the Choices Act, because it's ultimately about giving power to the consumer, giving the individual the opportunity to get the policy they want and the support that they need from the state to afford less than the $4,200 that Senator Reeves's constituent has to pay for insurance. It's outrageous. Yes, Obamacare is in a death spiral, but as I don't know who said, it really isn't. It isn't in a death spiral because the United States government has an open checkbook to pay for whatever it costs. I was talking to a friend of mine who was with an insurance company today, and he said that 85% of the people in his plan, in his state, under Obamacare are subsidized. So it's not going to go, how much further can it go into a death spiral? 85% get money from the federal government to pay for their plan. So if the premiums go up, guess what? The federal contribution to pay for the plan goes up. So the death spiral is in your pocketbook. This is going to cost more and more and more and not provide better care. I wish Governor Bevin, because he's good at this, he talked about health outcomes, but how Medicaid and health outcomes are not synonymous. And the idea that by what we've done, which is dramatically expand Medicaid and not dramatically expand private insurance, there are less people today on unsubsidized individual policies than there were when before Obamacare was passed. The number of people who are just out buying a policy because they want to buy a policy, an individual policy, is down. Medicaid has exploded. And as Governor Bevin, if you have a question, I'm sure we'll be happy to detail, Medicaid does not result in better health outcomes. So we are not helping people get better health care. That's what this is about. Finally, why are we doing this? I hear this all the time. Well, you have no chance of passing this bill. That's a lie. There is a confluence of events occurring right now that make this very possible. We have rates going up, average anywhere from 15 to 20% are being projected. We have some states like Maryland, which has a 91% rate increase being filed. You heard that rates have already doubled in 4 years. And so for the Democrats to run out and say, oh, it's the Republicans who are causing your premiums to go up, they've doubled in 4 years. But they will go up more. And if we don't do something, I fear that Republicans will be blamed for this. Why? Because we happen to control both houses of Congress and the president. And we said we'd fix it, and we didn't. And so you can go out and run and say, oh, it's their fault. I know the president likes to blame the Democrats, and I cheer him. But it ain't going to work. Because the public doesn't see it that way. So we have an obligation to fix this. Not just because people are being hurt, as you've heard, but because the politics also are devastating for Republicans in the fall. And I think conservatives and moderate Republicans alike are beginning to understand that dynamic. And it's only going to get worse as premium increases are announced in October right before the election. We have an opportunity to fix the short term and the long term with the proposal that we put on the table. And I am encouraged by the conversations that we're having in the United States Senate, which is what this is all about. It's all about getting 50 votes in the United States Senate. And I'm encouraged that we have an opportunity to actually do that. But we won't get that done without your support. Folks who are watching streaming, as well as the people out here in this room and others. I've been involved in politics in Washington for 28 years. And I've never seen an effort of this magnitude that was driven by grassroots people outside of Washington and some inside in the think tank world, and then brought to the Congress with the demand, pass this bill. They didn't draft this bill. This bill was drafted outside of the halls of Washington by dozens and dozens and dozens of organizations, grassroots and otherwise, who have been working and thinking and trying to put together something that, yes, can get 50 votes, but it's good policy. And we've actually brought this to the Congress and said, we want you to do what we put together. We're asking you to. It's never happened before. Never. And so I just want to encourage you that those of you who sit at home and say, Congress never listens to me. You know, they're not responsive. They just go in their rooms and they cut their own deals. Well, here it is. You want to make a difference? This is an opportunity to make a difference on 20% of our economy. Make a huge difference to the lives of millions of people who are hurting when it comes to quality health care for them and their families. So I encourage you to help us, and I'd be happy to take your questions.